Traveling. Who doesn't like to travel? Whether it is a personal trip or a business trip. When we are traveling, we do a lot of research. Of course, it is needed. And why do we do that? So that our planning becomes better, so that our entire journey becomes more pleasant. But when you are a diabetic, you need to do little more planning. Why? Because diabetic need a certain special care. And if you don't take care such planning, then this might make your entire journey unpleasant. Not only that, during your journey, you might have to divert all your attention towards your health rather than enjoying your destination. So, if you are a diabetic and if you are planning for a trip, you need to know about few things which are practically very, very important. And all of that I'm going to discuss in today's video. Namaste. My name is Dr. Tanvi Mayur Patel. I'm an endocrinologist practicing in Mumbai, India. Okay. Being a diabetes doctor, many times patients often ask me, Doctor, I'm traveling here. What do I do? Do you have any tips in mind? So today's video is going to be very, very extensive tips, and all of them are practically very, very important. Even if out of all of these tips, even if 2 or 3 tips comes to you handy at the time of your travel, I will consider that my video is successful, because I have seen patients getting stuck at their destination for a lot of problems. So what are they? Let's find out. First is when you are going to do the research. Okay, of course you are going to plan your itinerary and research about it. You also need to research about the place where you are going to stay. Is there any hospitals or a clinic or a pharmacy nearby? This is very important, because outstation you might not have as good vehicle or a transportation system with you. You might be dependent on a public transport, and at that time, if your medical setup is little far off, or if you are not aware of, it can create a lot of problem. Okay, so always when you're planning to book your stay, keep this thing in mind. Always have a pharmacy or a hospital close by. It will be very helpful. Okay. Secondly, before you travel, make sure you visit to your treating doctor. Very important. Why? Because diabetes is a long-term disease, chronic disease, and people often keep on taking the same medicine which they are taking since long time. And many times your medications might change, which you are actually not aware because you have not taken a follow-up with the doctor. You might not be aware that how well your diabetes is in control. So before you plan, always make sure you your blood test and you check whether your diabetes is controlled or not, and a visit to your doctor, because your doctor will be able to modify your treatment accordingly. And not only that, your doctor will prescribe you the medication for the certain period of time which you can carry when you are traveling. Of course, in today's video, I'm covering more of a practical points when you are going to travel by the air or in a foreign destination. Okay, but all of these points will be handy even if you're doing a domestic travel. So when you go and visit a doctor, your doctor will do your blood test, will check your sugars and modify your medication. Your doctor will give you a new prescription. Okay, so when you are going to have a new prescription of a doctor, certain things you need to be careful about. First, always make sure that the doctor has given you a prescription till you are going to travel. Okay, so if you're traveling for 15 days, your valid prescription should be at least minimum 30 days. Okay, so this way, when you're traveling at the security, if anyone checks your prescription, they are aware that you have a valid prescription. Okay. Secondly, in the doctor's prescription, make sure that all the medicine which he has or she has prescribed contains a generic name. Now, this is important, especially if you are traveling for a foreign destination. It might not be necessary that in other country or other city, the same brand name might be available. So in that kind of a situation, if you have to replace the medication, at least you should be aware of the generic composition so you can exchange your medication accordingly. Okay. Another tip is that your doctor prescription should contain the doctor's signature, valid signature, very important. Always take a help of a doctor and ask them to provide you their contact number. So in case if you are stuck up with any medical emergency, you can contact your doctor or to your nearby hospital or to your medical center from where you are getting treatment from. These are important points. Okay. Another thing is a vaccination. Lot many times in a plenty many destination, certain vaccinations are mandatory. So when you visit to a doctor, you tell that you are intending to travel to this particular country or a city, and based on that your vaccination can be modified. Few of the vaccination might increase your blood sugar. So again that needs to be adjusted, and that can be done with the help of your doctor. So these are practical, very important point. Okay. Another thing is a medical insurance. Yes, lot of times people think that when we are traveling for XYZ days, why to take a medical insurance, why to waste money? But believe me, this comes a very handy if at all you need any medical assistance in other destination, because medical expenses can be very high and it might give you a lot of trouble financially if you don't have a medical insurance. So always have a valid travel medical insurance which should cover most of the parts of the world. Okay. When you are going to take a medical insurance, again declare that you are a diabetic. Yes, the premium after the declaration might increase, but it is very important. We have seen people have not declared that they are diabetic, and when they actually needed the help of the medical insurance, it was rejected. The reason that you did not declare about your diabetes status. So declare that. I know premium can be high, it's okay, but if at all you will need that insurance, it will actually come to use. Otherwise, without declaration, even if you have paid a little medical insurance premium, that might also get wasted. So that's why declare and make sure that it has a validity and it covers the most of the part of the world. Okay, medical insurance, very important. Another thing, when you are going to travel, okay, at your, maybe you are doing a sightseeing, always be vigilant, always look around, where is a close by pharmacy, where is a close by medical setup. So in case if you need any help, you have certain help with you. Okay. Another thing is a language. Yes, when you are traveling to other destination, may not be necessary people over there will be speaking the language which you know. So in that case, it is important to learn a basic few words pertaining to your diabetes. So in case if you need a help, you can reach out to them. So at least learn to say, hello, I'm a diabetic. Hi, I need a medical help. Hi, I need some sugar because I am feeling low. These kind of statements translate in your destination language and learn that by heart. It will prove to be very handy with you. Next comes is the packing. Yes, again very important. I'm talking about the packing keeping diabetes in mind. So when you have a diabetes, make sure that you pack your oral tablets separate, injectables like insulin or any other injectable medication separately, your glucometer should be separate, and any kind of a needle and syringes should be separate. So this avoids the confusion at the time of the airport security. Okay. People often ask, doctor, how much should I carry? Okay, my practical advice is carry the double the quantity what you are actually going to be needful about. Okay, why double the quantity? In case any of the medicine gets lost or gets stolen or gets damaged, or if your insulin gets spoiled, you have a spare medications with you. So always double the quantity of your intended travel is important. And when you're going to pack these medicines, always pack in a separate batches. At least divide your medication in 2 separate bags. Again, important point, because if you lose one bag, you have the other bag which has all the medicines which you need. So double the quantities needed. Packing has to be in a 2 or 3 separate bags. Preferably you can give it to your family member if you're traveling with someone, or else at least keep it in 2 bags. Never keep your medication in the check-in baggages. Always keep your medicines with you handy in your hand luggage. Again, very important point from a security point of view. Okay, when you are going to carry the medication, keep your doctor prescription handy, because at the airport, your airport security people will check the medication and will ask you a doctor valid prescription. That's why it has to be handy. Many people use a pill organizer and they keep the medicines inside. It is okay to use when you are at your home, but not when you are traveling. I will tell you why. 2 reasons behind that. First, when you keep multiple pills in a pill organizer, there is a possibility that these medicines, when they are exposed to the change of the air temperature or air pressure, it might leak, it might break, it might become moist, and it might lose its potency. So please don't do that mistake. Secondly, when you are going to keep the pills open, okay, and at the airport security, if they catch you with this kind of a medication, your airport security person does not know which medicine is what, and they might ask you to discard all of those medicines. So please don't do that. Keep the medicine in its original packaging. Good for the security reason, and it is also good for your medicine safety point of view. Okay. Another thing is that if you are going to travel with any kind of insulin, okay, again, insulin has to be well labeled. Okay, insulin has to have its own expiry. So when you purchase the medicine, always check the expiry of the medication, including the insulin. Okay, check the insulin, what is the color of it, and just check whether insulin is becoming spoiled or not, whether it has changed with the color or appearance. If yes, it might indicate that your insulin is not very, very effective. Okay, so these points you need to keep in mind when you are traveling. Secondly is when you are having your hand luggage, always keep some food handy with you, because you never know, you might land up with a hypoglycemia or a low blood sugar, and you might not have any food handy with you. To avoid such kind of a medical emergency, always have some food handy with you. So in case you feel low blood sugar, you have immediately food to eat. Preferably you can keep maybe a liquid sugar or maybe a sugar sachet. They are also enough. Okay. Another very important point is that when you're going to travel with the insulin, okay, when you open the insulin, write down the date of opening of the insulin. It is very important, because once you open the insulin, it has a limited shelf life. So ensure that you write it down. Not only you are aware of the expiry date, but also the opening date, so you are well versed with it. Okay. If you are traveling with the glucometer, always remove the glucometer battery separately. Don't keep it inside, because the air pressure might cause a battery issue. So remove the battery, keep it aside, and always carry a few extra spare battery with you. Very, very important. Okay. Many times glucometer, which is available in a different country, okay, is the reading how they measure is different. In India, we measure the sugar in the milligram per deciliter. But when you are traveling abroad, their measurement is different. Their measurement is millimole per liter. So you need to know the conversion of that. Okay, 1 millimole per liter is 18 milligram per deciliter. You need to be aware of this conversion. So in case if your sugar level is 10 in a foreign glucometer, you should know that it means 180 milligram per deciliter. Again, if you want, you can carry a chart which is very easily available. You can search it and you will be getting it. Take a print out and fix it with your glucometer so that you are well versed about it. Medical identification, very, very important document. Always wear maybe a medical bracelet or a medical necklace. It is very important because this kind of a medical bracelet or jewelry has written some essential information about you, your name, your country, your contact number, emergency contact number, and a most important that you are a diabetic. So in case if anything happens to you and someone else needs to assist you, at least that person knows where to reach out. Again, people take it very lightly, but this is life saving at times. So medical bracelet or medical identification is very important, not only at the airport, but keep it with you all the time when you are going to travel. Okay, few points keeping insulin in mind, especially how do you store the insulin. See, once your insulin is not opened, you have to refrigerate it. Once it is opened, you can keep it at a room temperature. However, when you are traveling, the room temperature might not be available everywhere. So in that kind of a situation, the storing of the insulin is very important. Nowadays in the market, you do get a cold insulin storing wallets. Do invest into one, buy a good quality of the insulin storage wallet. It will be very, very important for you. Okay, before you use any insulin, always check the appearance and the color of the insulin. If you think that it has spoiled, don't use such insulin. It might harm you. Okay, and discard that insulin. When you're talking about the insulin, make sure that the destination where you're traveling, ensure that the same insulin type which you are using is available. May not be the same brand, but alternative brand, but at least it should be available. This is very important, especially if you are a type 1 diabetic, because we have seen type 1 diabetic people, once they see that their entire batch of the insulin is spoiled and they are stuck very badly. So please avoid that problem. Always check at the destination whether what kind of insulins are available there. And to be on a more safer side, always take your doctor's opinion before you travel, that doctors in that country, this insulin is available. If I am stuck, what do I do? Will this insulin work? If it will work, what dose I have to take? So in case if you are in a destination and you are not able to get hold of your doctor or medical team for any reason, you have a plan B in action. So this is very important when we are talking about the insulin. Okay, when you are going to carry the insulin, of course you will need a insulin, you will need syringes and needles. Carry the extra pair of needles and the syringes. Not only that, discarding is also important. So carry a sharp container wherein you can keep all of these needles and syringes safely. Please don't throw it here and there. It can be a biomedical hazard and you should not disturb other individual or other human or any other form of life. Don't throw your needles anywhere except the needle throwing the metal container, which is available very easily. If you don't want to spend money on that, then in that case, at least carry one empty plastic bottle with you. Keep all of these disposables in one place, and once you come to your right destination, discard it as per the instructions given to you by your medical advisor. Please be little responsible and don't litter this medical hazardous things anywhere. We have seen people using and throwing this in the airport, at the airport washrooms and even inside the aeroplane lavatory. Please don't do that. Very, very important. Okay. Another thing when we are going to discuss is the in-flight. Okay. When you're traveling inside the flight, what things you need to keep in mind? When you are going to book your flight ticket, okay, if you have an option of a seat selection, okay, always select the aisle seat. I'll advise don't select a window or a middle seat. Always go for the aisle seat. Why? Because in case you want to need to use restroom, which is very common in a diabetic people, you have it very easy access to it. Also, if any point of time, if you need any medical assistance, it will be easy to reach out to you. So aisle seat always works best. Okay. And when you are within the flight, make sure you have your medicines, make sure you have your insulin, make sure you have some food handy with you. If you have any special kind of a dietary restrictions, always pre-book your meal and inform your airline about your meal preferences so that you can plan your meal accordingly. Okay, always go for a well cooked meal. Don't go for undercooked or a raw kind of a food, especially when you're traveling. It might give you a diarrhea if it doesn't suit you well. So, and a low sugar kind of a food is always essential. Carry a meal with you in case for any reason you are not comfortable or that you don't like the taste or you are not finding the right food for you. You have a spare meal with you, so it is very important. Okay. In case if you need to take insulin within the flight, you need to keep few things in mind. So air what you inject in the insulin bottle is different at the ground level and different at the air level. So you need to inject less amount of air within the insulin vial. Okay, so keep this point in mind. And another important, when you are sitting in the flight, especially for a long period of time, make sure that you drink plenty of water. Dehydration is very common, and again this can disturb your blood sugar. After every 10 to 15 minutes of time, if feasible, walk around within the flight so that you don't get any kind of issue in your feet. Lot of times due to the prolonged hour of sitting, you might get swelling within your feet. So at that time, it is important that you wear shoes which are very, very light and easy removable. Okay, don't wear any kind of a fancy, difficult to take out kind of a shoes. Okay, a one pair bigger size will be always handy with you because of the leg swelling, which is very common. And if you have such issues in the past, always wear a compression stocking. Again, it will be very, very helpful to you. Now we'll talk about certain time zone. When you're going to travel in an Eastern time zone, okay, at that time, the day becomes shorter. So your need of the insulin might be reduced in the beginning. Similarly, if you are flying in a West zone, then the day over there is long, and in that case, there can be a temporary high need of your medication, especially the insulin. So keep this point in mind, okay. Another thing is a blood sugar checking. Very important, keep checking your blood sugar on and off because it will help you understand your sugar control, and based on that you can take a action. When you are going to take a sugar measurement immediately after the flight, okay, there can be a jet lag. You might find that your sugar levels are not very accurate. So once you are well settled on the ground again, do check your blood sugar, okay. Similarly, if you check your blood sugar at a higher altitude, you might find that the readings which you get are not very accurate. Similarly, if you are under a lot of stress or if you are under a lot of excitement, which is very common during travel, okay, this can temporarily increases your blood sugar. So all these points you need to keep in mind when you interpret your blood test results, okay. Now I'm going to cover few basic things which you might think may not be very, very important, but yes, they are. First is the clothing. Make sure you wear a loose, comfortable clothing so that it is so that your travel becomes easy. Along with the diabetes, if you have a thyroid problem, especially hypothyroid, make sure you wear a full sleeve clothes and with the hoodie, because people often find lot of, they find that they feel very cold. So keep maybe a warm blanket with you or wear a full clothes so that you don't end up with the feeling cold. Okay, so clothes are very important. Appropriate clothing as per your destination and as per the environment where you're traveling is also important. Okay. Secondly, we are talking about the food. Okay, the food is very important because food is actually going to impact your blood sugar the maximum. Okay, so what kind of a food points you need to keep in mind? Of course, when you're traveling, you might want to indulge into the food over there and you want to just enjoy your life. No problem with that. However, make sure that you eat responsibly, mindfully, so that your blood sugar doesn't rise to a larger extent. Okay. At the same time, you don't have to keep yourself hungry for a long period of time, because if you do so, your sugar levels will fall down. You will end up with a medical emergency called as a low blood sugar. So always, whenever you're traveling, even if you're going for sightseeing, always keep a one meal handy with you in your bag, which is accessible to you, because you might not find the kind of food what you eat very routinely everywhere. And especially if you are vegetarian, then the restrictions can be more if you are traveling abroad. So keep this point in mind. Okay, if possibility, try to avoid the raw and uncooked meal. Okay, because this kind of food, there's a high possibility of the contamination, and there is a more possibility that you might have a diarrhea or a loose motion. Having said that, you might land up with a dehydration, and this can trigger the diabetic ketoacidosis or a hyperglycemic episodes very commonly in a type 2 and a type 1 patients. Okay, so this point needs to be kept in mind. Okay, of course, when you are eating out, just check the basic hygiene of that place and just take your smart decision. Okay, coming about the hydration, again very important. Dehydration can impact your blood sugar to a larger extent. Your body cannot process the sugar in the right way, and dehydration can give you a diabetic ketoacidosis, again a medical emergency in a type 1. Okay, similarly in a type 2 diabetes, it can be a different medical emergency like a hyperglycemic hyperacidosis. So you need to keep this point also in mind. And of course, dehydration can impact on your kidney also. Okay, so water we did, and the food intake is important. Next, coming about the sun safety. Yes, sun safety, make sure that you have some kind of an umbrella or a sunscreen. Very important, because a sunstroke is also common, especially if you're traveling into a hot destination like a UAE or a Rajasthan, such kind of a state in India. Sun safety is very important. Make sure you don't walk barefoot, especially whenever there is a heated temperature, because if you have a diabetic and if you have a neuropathical problem, this might give you a lot of trouble, especially if the neuropathy, you can't feel the warm or hot sensation, and it might give you a blister. Okay, so avoid walking barefoot. Even this rule applies at the beach. Yes, at the beach, yes, you want to walk barefoot and you have connection with the earth, very important. But avoid walking barefoot on a beach, especially during the sun time, during the afternoon time. And if you are walking barefoot, make sure that you keep in mind the shells at the beach, because this kind of a trouble can leave you a long problem. Okay, so avoid walking barefoot. Now we will talk about the feet safety. Yes, people often neglect it, but diabetic people should know about the foot care. Very important, because this can prevent you from a dreadful amputation. Okay, so when you are traveling, always carry a 2 to 3 pair of shoes with you, and all different types. Why? Because we have seen when you are traveling, you need to walk for a long period of time, and this can create a pressure points at the feet, and this can give you a shoe bites. So always carry a 2 to 3 different variety of shoes. So if one type of a shoe is giving you trouble, you have a other pair handy with you. Okay, always carry your shoes or a footwear which are very easy to wear and easy to remove. Okay, try to avoid wearing a open kind of a shoes like a slippers or a flip-flops, because you have a higher chances that any kind of a injury can happen to you easily. So always prefer a closed kind of a shoes, which is again very important. Under no circumstances you are going to go barefoot walking, even if your journey is for a holy pilgrimage kind of a destination. Again, avoid barefoot walking, because this can give you a lot of blisters, and this can give you a long-term problem, and you might develop an infection in no time. We have seen even a simple kind of a thorn or a simple injury leading to a very complicated injury in 2 to 3 days time. So especially when you are traveling, make sure that you wear your socks. Again, very important. Nowadays you do get a silver lining socks which are healthy for a diabetic people. Do invest in 1 or 2 and wear that. Okay. Another important point is always examine your feet. The way we examine our face every day in a mirror, examine your feet also. Check for any kind of a redness or a blister or any kind of injury, cut or scraping. If yes, take a timely action because this will protect you from any kind of a foot issues. Okay, very important. Next, we will move on to exercise. Yes, exercise and diet are two major things which is going to affect your sugar. So when you're traveling, it's not an excuse for you not to exercise, especially if you're on a very luxurious leisure trip. Okay. Always, if you are planning to do exercise, keep it in a cool environment. If you stay in a good hotel, if you have a gym access there, go visit the gym. Don't do exercise in an open sunlight when it is very hot. It might give you the dehydration. If you want to do open exercise and in the open air, then in that case, you wake up early morning, do the exercise, but during the afternoon time or when the sun is very harsh, don't do exercise outdoors. Okay. Sometimes, okay, when you are traveling, you might experience unexpected physical activity, such as walking in a mall or going for a sightseeing, walking. Okay, so in that kind of a situation, always keep your sugars in check and avoid any kind of a low blood sugar, again, which is common. Okay, when you are going for any kind of a trekking or something, keep a food handy with you so that in case you feel that your sugars are falling, you have something to eat. Okay, and if you're planning to do a exercise, always keep in mind the peak action of the insulin which you are taking. If you do the exercise at the time of a peak action of insulin, your chances of developing low blood sugar further increases. So keep these points in mind when you are doing any kind of physical activity. Now, I will cover few important points for type 1 diabetic and people who are using insulin pump. It might not apply to all the diabetic, but if you belong to this category, do listen this point also. Okay, so first of all, if you are using an insulin pump is the latest medical device which allows type 1 diabetic to use insulin without the frequent injection. Okay, so if you are wearing any kind of insulin pump, always write an official email to your flying airline that you are a type 1 diabetic, you are wearing an insulin pump, and kindly allow me and kindly help me in the security assistance. This is very, very important because what happens, insulin pump has a small area where you store the insulin. And if you don't take care of insulin pump, all the insulin which is present in the pump can get failed and it might get spoiled and it might affect your blood sugar to a very larger extent. So if you are wearing any kind of an insulin pump, always inform. And if you are wearing a pump, make sure that for your security, at least you leave 1 hour prior. Because we have seen insulin pump user having lot of trouble at the security checkpoint, and because of that they even miss their flight. So do such a proper calculation of the time, leave 1 hour prior and always take your time. Okay, when you are traveling with the insulin pump, when you are at the security, okay, you need to inform the security person that I am wearing so and so medical device, and please carry a valid letter from your doctor. Again, very important. Okay, many times for such security reasons, your security officer might ask you to remove the pump. Please don't do that. Ask them, please check the pump which I am wearing. Let them supervise, let them examine. If needed, you might go through the metal detector. Under no circumstances try to remove the pump. And secondly, don't allow this pump to pass through the X-ray machines because it might get damaged. Okay, so be a little mindful about it. Inform your security people accordingly. Write an official email, take their declaration, and do all the security needed. However, at the same time, protecting your insulin pump. Okay, and if you are a pump user, carry double the amount of the insulin with you. Very important for type 1 diabetic. Not only that, type 1 diabetic need to carry even a ketone sticks. Yes, these are the small sticks where you can measure the ketones present in your urine. Okay, this can help you understand whether you are developing any kind of a diabetic ketoacidosis or not. This is important for type 1 diabetic. Okay. If you are an individual who have difficulty in understanding that you have a low blood sugar, what we call it as a hypoglycemia unawareness, you need to be very, very careful, and you need to measure your blood sugar every now and then, even if you don't get any symptoms. And in that kind of a situation, you should always carry a glucagon injection, which is an injectable medicine which can improve your blood sugar in no time. However, glucagon injections need to be administered to you, especially in a severe hypoglycemia, by someone else. So make sure that such kind of a person is with you, or you carry a proper instruction, medical instructions accordingly. So these are very, very important point, keeping a type 1 diabetic in mind, because type 1 diabetic can land up into diabetic ketoacidosis in no time. Within few hours, this problem can happen, and it can completely spoil your entire destination and your travel. Okay, so be vigilant when you are traveling. Okay, the entire purpose of this video is to make sure that at which all steps you can make a mistake and how to avoid them. By no means this video means that, oh my god, I am a diabetic and look at this doctor telling so many things and giving me stress. No, even if few of the tips, if it comes handy to you, I will be very happy, because these are the practical problem which happens to people when they are traveling. Okay, not your journey doesn't end here. Once you finish your travel, write down your individual experience in a diary. So next time when you're flying back again, you are aware that what mistake I made last time and what I should avoid. You will learn from your own mistake. Of course, this video is there for you, but there can be few points which might not I have covered in this video. So you have those points handy with you so that you can travel safely. When you plan yourself and when you plan your entire travel, you can enjoy the memory of your destination. You don't want to bring unpleasant memory that, oh my god, I have diabetic and I got this problem and I had to rush here. I was gone out of my medication. I could not find my medicine. My insulin was spoiled. Oh my god, I developed a low blood sugar. I'm sure all these unpleasant experiences, you don't want to carry them and bring those unpleasant memory. And if not, then that's the reason why follow this video as much as you can. I hope this video is helpful to you, and if you like the video, please click on the like button. And if you are new to my channel, please don't forget to subscribe so that I get more boost of energy to make such videos. And if you have any of your personal question whose answer you are seeking for, write that in the comment box below. I try to read and answer them as early as I can. We will meet again. Till that time, you take care of yourself. Happy journey. Namaste.